Good afternoon, everyone. Thanks for coming. Let me just hit myself hooked up here so I can see everyone. Beautiful. Hi, Killer Whale. Thanks for coming. I'm gonna get started in just a few minutes. I want to let some people get in here, and then I'll get started. We can get connected, and hopefully, you guys can get some new friends tonight, some new subscribers, and hopefully, if you guys have any questions in regards to hip replacements or hip pain or whatever in general. But I kind of made this as a discussion of hip replacements. There's still a good like 5 or 10 second lag between actively talking and actually the stream itself. So it's kind of interesting. Maybe it's because I put the higher quality marker on the YouTube, and so that might be making things run just a little bit slower because of that. Pennsylvania Trapping's in the house. Hello, Pennsylvania. Come on in. Thank you so much for coming. I'm going to start in just a few minutes, and once we get some more people in here. Oh, PA, man, I saw your April Fool's this afternoon, man. I was like, man, you sold that pretty good. I thought for a second there that, I'm like, okay. I mean, his channel's actually doing quite well. And then I remembered it was April 1st. I'm like, and then all of a sudden you said April Fool's. So that was a pretty good, that was good. Oh, thank you so much. Yeah, that's a good idea. I think I'm going to do the same thing, share the stream out. I always forget to do that. I don't know why, but I do. All right, and I'm also going to put it on Facebook too while I'm at it here. All right, let's see if we can. Candy Doll's in the house. Good afternoon, Candy Doll. Thanks for coming. I'm going to give us like 5, so I got 2 more minutes. I figure I'd give everybody about 5 minutes to hopefully get done. Um, we'll see how this works out. So I'm starting the streams at 6 o'clock now. I wouldn't want to go any earlier than 5:30 just because of me getting home from work, as well as some other stuff that I need to get done prior to starting the live stream. And I don't want to do Mondays, or excuse me, Tuesdays, because we have all the RV people and they have a whole channel. They got like 5 or 6 people that do channels, that they run their channels on Tuesday evening. And so I figured it wasn't nice to try to compete with them at all, like I could anyways. But do you guys have any questions at all before we get started in regards to hip replacements? Hi, Nicole. Thanks for coming. So I got a few people in the house right now, not too many. We're dragging, so we'll see what happens. I sent it out to my subscribers as well as I sent it out to Facebook. We'll give it a few more minutes. Probably everybody's home doing homework with their kids nowadays. It seems like that's the new norm. I didn't think there was a lot of people doing a live tonight. I didn't see a lot anyways. But there's a lot of people home and they're doing lives throughout the whole day now. So I guess we'll get started here a little bit, and if I need to review it a few times, I will. So tonight we're going to talk a little bit about hip replacements, and there's two different approaches to having a hip done. Why you need a hip replacement done in the first place is always should be probably the first question. Now there are some people, unfortunately, where the blood flow, we're kind of look at this thread as actually where the artery comes in to the head of the femur bone here and kind of sits in like that. You got obviously one on each side that makes up your thigh bone. And if this, for some reason, this blood flow, this main artery gets compromised, the entire head of your femur bone will die and you'll have to have a hip replacement. And it's known as what we call avascular necrosis, or AVN for short. And there was a famous baseball / football player. He did both. He was professional at both back in the, gosh, I think it was the late 80s and early 90s. I'd have to look it up. But his name was Bo Jackson. And Bo knows. Nike did a lot of commercials with Bo because he was one of the first to be able to do two professional sports at the exact same time. I don't think it had ever been done before then. So, hi Medic Bunny, thanks for coming. Tonight we're talking about hip replacements. I just got it started, and I was just talking about avascular necrosis, and that's kind of like the first thing. Why would someone need a hip replacement? It would be because of that particular diagnosis. And that can happen at any age. If you get into a trauma, a car accident, a fall or something like that, and this artery gets interrupted, yeah, this is done. They're not going to be able to repair this. This head of the femur is going to die. So that's one. The next one is osteoarthritis. And so there's a couple of different kinds of arthritis, but osteoarthritis is the kind of normal aging wear and tear that you can have in any joint in your body. And you can have it both. Both. It can. Let me take it up. You know what? I'm having trouble hearing you. that would be my watch or Big Brother FBI probably listening into us. But let me take it off of little baby me here. And so the other main piece is the cartilage that's on the socket. So you have cartilage on the head of your femur, as well as let's see if I can get that popped off there. Your little baby femur. Let's look at the difference. Oh, isn't that cute? And so you have the socket here, or what we call the acetabulum. And the acetabulum itself has a labrum on it like you do in your shoulder that we've talked about before. Nicole says she has exciting news she wants to tell us. Okay, what's the exciting news that you want to tell us? But it's really important, though. Well, you tell us, and I'll shout it out if no one can read. All right. And I have an announcement to make that you guys want to hear. Yes, of course, Nicole. We want to hear us. You have us at, anticipation. So go ahead and tell us exactly what you are just bursting out to kind of tell us. All right, she's holding back. Maybe she's pulling an April Fool's joke. This is April Fool's Day, and PA Trapper did that on his channel earlier. So we better make sure, Nicole, this isn't no April Fool's joke. Okay, so the basically the socket, what I was talking about, has cartilage within inside it that also has cartilage along the head, and so you have cartilage on cartilage, so you have a nice smooth joint. And as we age or as we gain too much weight, you start to get wearing in certain parts of the ball because the ball is not rotating enough around, and or you're in sitting positions or whatever, static positions too long, or you step off of something repeatedly the same way for thousands of times over, several years, and you start to wear part of the head or part of the socket. And if it flattens out and it gets painful enough, wear the cartilage out, next thing you know, you have arthritis in that spot. And every time you try and roll the ball and it hits that arthritic spot, it's going to give you a lot of pain. Well, apparently she's moving apartments. Well, congratulations. Make sure that you wipe whatever you're down the next apartment that you go to. Obviously, we wouldn't want you to get the flu or any other virus, including this COVID-19. And so if you have a lot of wear in that spot, next thing you know, you have some pain. A lot of times, they'll send you to conservative therapy first, one of me, or they'll maybe do some injections in that area if it can help that. But if the cartilage is worn down too much, then they'll go ahead and replace it. So that's another reason why you might have to have a hip replacement. Okay, let's say good old grandma or grandpa, all right, falls and breaks their hip. Now, when we think, everybody generally thinks of the hip, they think of the ball and socket, okay? But in reality, the hip is just all one unit, and what people are really thinking of is the head of the femur. And so they fractured somewhere around the neck of the femur bone, or they shattered the head of the femur, and they have to have the whole thing replaced. And so that's another possibility, just to fall. Grandma and grandpa fractured their hip. There's some pretty scary statistics out there. I haven't looked up them lately just because I've been busy, and I haven't needed to think about thank goodness, too much of that. But at a certain age, if you do fracture your hip, the timeline is 6 months. And that, what I mean by that is there's kind of a higher death rate at a certain age group when they fall and break their hip within that first 6 month window after recovery. And so if they can get past that 6 months, a lot of times they'll be fine. But there's a lot of things that can happen when you get elderly. There's a lot of what we call comorbidities that people are talking about in regards to this COVID-19. If you have a history of asthma or you have some sort of, if you're smoking, or if you have high blood pressure or diabetes, these are all what we call comorbidities. And these underlying issues that people have can play a major factor in regards to healing from COVID-19 infection, or in this case, it's probably pneumonia or sepsis, and or from a fracture. So there's all these underlying issues that some people will recover from a hip replacement much better, much quicker than others. It really depends on how physically fit and how many comorbidities you had prior to having the surgery. Miss Medic Bunny has a question. All right, I love that name. All right, Miss Medic Bunny, you go ahead and throw the question out, girl. Let's see if I can answer it for you. I got 5 in the house, by the way. Hit the thumbs. Hit the thumbs up. I love it, or thumbs down if you think I stink. But I hope you'll give me thumbs up. But either or, at least I know you're responding to my content, whether it's positive or negative. Brown Eyed Truckers here. Nice haircut. Oh yeah. Well, what I did is Trucker, I got this cut like a week or two ago, and basically between the lights, between the natural light that you can't see that's behind the camera that's hitting me, as well as I basically ramped up all the quality of sound as well as the picture as high as it will go, 1080p. And so you're seeing me in high def, and so you're gonna see all my faults, all my short hair now. I had a 97-year-old patient with a hip fracture a couple of weeks ago. They did a total hip replacement on her. Why would they do that on someone at that age? Well, that's a good question. What they would look at is two things. One, they might look at it as comfort to reduce pain. That's one possibility that they did that. It could be because the hip or the ball and socket was so, it might have been fragmented, all right, or what we call in the business comminuted, which means that there's multiple breaks and the bone is pulled apart in spots, and that's why they might have had to replace it. But and a 97-year-old, if they were still semi-mobile, whether it was DME or durable medical equipment that we call it, whether it's a walker or a cane or something, or even wheelchair, maybe for safe transfers, for maybe her bed to the bathroom or a bedside commode or to the shower. So that might be the reason why they did it. Obviously at that age, they must have been pretty decent because medically to put someone under at that age, it's a very high risk. I'm not an anesthesiologist, but just common sense would tell me if someone's 97 years old, when you put them under, they might not come back out. Got 7 in the house. Connect if you love each other, if you like the stuff. Okay. If it's anybody that I'm not subscribed to, I will go ahead at the end of my live stream, go ahead and click on you all, subscribe, and leave a healthy comment. Make sure you guys are leaving a decent comment, whoever you subscribe to, because I had a bunch of people that I'm still going through that YouTube put in my spam mailbox, and some of it's like 3 and 4 weeks ago, and so if you don't, and they probably watched my content for maybe 40 seconds. So if you're not watching things for a minute or two, if it's a fairly long video and you're just putting a bunch of nonsense down, YouTube's going to throw it as spam and no one will ever see it unless, like me, going through the spam box of YouTube. Sylvia Life in Holland says, please connect. We'd love to have you connect. Oh, please, miss, do not put a check. We don't like a check. All right, I'll take a thumbs up every once in a while, but that's not spam, Miss Sylvia Life. All right, Miss Medic Bunny, I'm glad that I kind of answered your question a little bit. But a lot of times when someone's that old, they're doing it for comfort care a lot of times, just to make sure that they can still maybe do transfers, or, if they were mobile walking before, then maybe get them back to some sort of function after the surgery. It also becomes an ethical issue too. You ethically leave someone with a fractured hip when you can replace it. I would say do no harm, and that's the first thing that they do, the old oath, and go from there. Well, God is with me and my family in real life. Well, that's good, Nicole. I'm glad. Any more questions before I keep on babbling? Okay, and so we went over a couple different ways and reasons why you would need a hip replacement. Trauma, blood flow is lost, too much arthritis. Now, that could be osteoarthritis. It could be rheumatoid arthritis, the RA, which is a systemic that can affect any joint in the body or an organ. You could, it's escaping me, psoriatic arthritis. It could be that, and that could damage the joint. Now, arthritis in the hip doesn't do too bad. if you don't weigh a whole lot. And what I mean by that is for every 1 pound you're overweight, 3 pounds of pressure on this old ball and socket. And so if you weigh too darn much, yes, you're going to wear this thing out. The other little tidbit, because I always like to throw little tidbits at people, hopefully, is as we age, people say you lose your height, and that is true. And one of the reasons why you lose height is actually as you age, the neck of your femur starts to tilt down. You actually start to lose this angle between the neck and the head of the femur as we age. And so if your neck is like this, over time it will start to tilt down. You can thank good old-fashioned gravity for that, as well as probably weight bearing. And so yes, that's another way of why you might lose your height as you age. Well, thank you, Brown-Eyed Trucker. You're a faithful watcher. I love you. I'm waiting for X-Ray Girl. I don't see my X-Ray Girl in here, so she was probably busy tonight. But she's also another one. Lionel, I don't know what's going on with him. He comes and goes pretty often. Larry 5200 comes a lot. I think this is my 7th live stream. And like I said, on Sunday, I'm also going to review an old video on Sundays, like probably 10:30 in the morning Eastern Standard Time. If you guys want to do that and ask questions about, you know, how I make my videos or things that I'm learning that maybe might help you, or we can help each other. That's always cool to kind of bounce off stuff like that. So I'm doing that on Sundays. I think I changed my channel art. I think I did that Sunday afternoon. It also says Sundays. Hi, Maggie. Oh, good old Maggie's in the house. That's the girl. This girl goes live all the time, people. I couldn't catch up to her with live streams if my life depended on it. She's on live streams so much, and she's always very, very nice. And so if you'd like to get your channel moving a little bit quicker, maybe get some more subscribers, some more family members, you could always head over her. And she does lives all the time. She does some content, but most of hers recently have been live streams. And she's very nice. She likes to have the bubbles in the front so you can't see her pretty face. So I'm not sure what that's all about. I don't have any bubbles, but I probably should have bubbles. This Nicole, she's hungry, she's thirsty. You're welcome, Maggie. I'm just speaking the truth, girl. Okay, so I got 7 in the house. Hopefully we'll get some more. Some people come 6:30 because that's when I used to start these live streams, was at 6:30. And it's only been last week and this week that I started at 6. And we'll see what happens. I like to do 6 just because that way, you know, we're not going into the wee hours of the night. People aren't in Eastern time zone. I mean, if they're in the Pacific or Western, you know, and the reality is this is 2 or 3 hours behind, and so they might be getting out of work. So it's kind of hard. Or I got a lot of family members, subscribers that are from the Philippines, and so they're like 12 hours. Some of them are 12 hours ahead. So some of them it's like, you know, 6 o'clock in the morning. Well, thank you, Medic Bunny. I try. I'm trying now. My last video, I brought in 2 new characters. Basically, Dr. Know-It-All, or So-and-So, and Dr. Cool Cats. And they will be continuing to make their presence known in some of my videos, as well as continuing with my boy here, Mr. Scully over here. And so we'll see how my 3 characters, including this number 1 character, works out. Yeah, Maggie's on midnight side, so she's 6 or 7 hours ahead. I knew she was ahead, I just didn't know how much. but it's probably good for her to come in different times if she can, because she'll get some different subscribers versus always getting the same one on the same time zone and on the same kind of websites, or in this case the channels. And so she's doing very, very smart in that way. That way she's pulling people from different genres, different channels, and different time zones to really try and get her subscriber base a lot more, what's the best word, complex. I guess there's probably a better word than that, but a lot more different variety, I should say, variety and complex of people within her pool on her channel. It will definitely help you in the long run, and that's what I'm trying to do. That's why I'm going all over the place. All right, so we went over the kind of some different reasons why you need a hip replacement. Now, it's been probably, it's for me in my practice where I work and what I've done through the years, it's probably only been the last maybe 5 years at the most that I'm starting to see younger and younger people get hip replacements. I'm talking about people in their 40s, and it used to be, 60s and up. But because of the hardware that they're putting into these hips now, they're lasting a lot longer and they're a lot more durable. So they're giving this particular invasive surgery to a lot of younger population that they used to not. And so some of the outcomes are also a little bit better because we're also dealing with a younger population. Now, when I first started 20 some years ago, when you had a hip replacement, you were usually in there for probably 4 or 5 days. If you got people out in 4 or 5 days, you were rock stars. Some people, it was seven days before they got out of the hospital after a hip replacement. And now you're lucky if you're in there 3 days. And that's about it. You're either going home, which is more than likely what's going to happen unless there's some severe complication like a blood clot or something else that went wrong. You might go to short-term rehab if you don't think you're up to going home, if you live home alone or something like that. But you're going to go to outpatient afterwards. So you're going to go home, and then probably that next week you'll be going to an outpatient physical therapist like myself and someone else around the country, around the world. Well, thank you, Medic Bunny. That's very sweet of you. Yes, I'm not only trying to make my content valid and thorough as best as I can without really boring the public, because it's very quick, very easy to do that. I'm trying to make it a show, trying to make it kind of fun, character development and stuff like that. And so we're going to see where I go with this. There's a few other ones out there, physical therapists, that are fairly big. Everybody else is usually either muscle bound, they have maybe an athletic trainer, they might have their ATC, it's called, certification. They might. More times than not, they don't. You have some people out there as physical therapists that they just talk about either their clinic or how to become a physical therapist. There's a few people out there that do that. My genre is usually, or my niche, I should say my genre. My niche is basically trying to give treatments that you can do at home, not just stretching and strengthening, because there's a few other people that do that. Bob and Brad have been doing it for 7 to 10 years, those two guys, and they got over 1 million subscribers. They've been rock stars, but they've been doing it since the dinosaur age. And they kind of do, you can see some of their videos, they kind of, do their little slapstick comedy pretty quick, because they can kind of, talk about each other for a second, what's going on. And then they go into whatever their issue, whatever's going on, whether in this one case it was, in this case it might be a hip replacement. And then they'll kind of show you some stretches or strengthening, and that's it. That's the end of their show. My take is trying to make it more fun, more laughable, make it more of a TV show, and also give you different types of approaches, whether it's taping techniques, electrical stim, whether it's massage techniques, positioning techniques, different ways to manage your pain, and kind of give you some ideas where your pain might be coming from. And so I took that approach. That's still my approach for the show. These Wednesdays are more of education of what I'm going to do this weekend, this Saturday show, and then obviously I already talked about what I do on Sunday. Yes, there are a lot of medical secrets that I am giving away that you normally would probably pay a lot of money to hear or see. That's probably why a lot of people don't do this, because they would get paid to do this. So whenever you do a shoulder video, I have a question about that. Yeah. I think I did one a while back. Did I do a live stream? I'd have to look. I've done a couple on the back, one on the neck, one on the SI joint. I'm not sure if I did one, a specific shoulder one. I'd have to look back. I know I've done a bunch of videos. I have a whole playlist on shoulders if you want to look at that. But yeah, maybe I'll do one next. Maybe next week I'll do a live on the shoulder. It can't hurt, right? What you do makes it more memorable. Why, thank you, Medic Buddy. I try. We'll see how it goes. I'm doing all right so far. Consistency is what all these big YouTubers and kind of the middle YouTubers, say. It's all about consistency. If I look at some of their videos when they started, they started just like we did. The stuff looked awful. The content wasn't that good. And they kind of worked their way up. So, in that regard, they just started earlier. And we're just kind of hopefully also learning from some of their mistakes too. So that's always nice to be kind of when you don't have to be first, but unfortunately, they got a huge leg up on their subscribers. So we just have to do things a little bit different than the rest of them so that we kind of stand out in the crowd, so to speak. I don't think I've seen anybody that does this like me. So I'm hoping I'm kind of the first that's doing this kind of niche when it comes to orthopedic, neurological problems, physical therapy-based approach. I'm hoping I'm the first to kind of do it like this. I think I am. I don't see anybody else doing it like this. All right, trucker, I will come and see it probably either tonight or tomorrow. I'll come and take a gander at her. So I got 5 in the house. Hopefully I can get some more people in here. I'm not sure if I need to just, consistency with time. I know there's a couple other YouTubers out there that just do live streams. Like Milda's probably on. Milda family's probably on right now. And he's starting at 4, so he might have gotten off 4 or 5. He's been starting. He's all over the place, but when it comes to his times. But anyways. So let's talk about the 2 different types of hip replacements you can have. Now this Saturday, my show is going to be on the different types of hip replacements and some expectations you should have. So I'm going to give you probably some insights of what I'm going to be talking about this weekend. So there's 2 types of hip replacements, really. There's the backside approach where they actually come in. Okay, they come in from the back side of your body and they kind of come down in an oblique angle and they kind of split the muscle fibers in the fascia, the thick tissue in between the muscles themselves to get to the head of the femur itself. Obviously dislocate to get the head out, all right, and then replace it from there. Now that's called the posterior or posterior lateral approach. That was what we call the gold standard in the research terminology. That was the one that has been done for 25, 30 years until probably like the last 10 or 15 years, where now they're doing the other approaches from the front, where they will have a machine where they extend your leg out, they will distract the ball away from the socket, and they will go from the front, to do the replacement. Now, there's 2 significant differences between going from the front and going from the back. Now, the back approach that's been done forever, what happens is you can't cross your legs after surgery. You can't turn your leg inwards, all right? And then you can't bring your leg up past 90 degrees, or in the same, you can't let your body come forwards past this 90-degree angle between your thigh and your chest, because you could dislocate after surgery, because they had to go in through the muscles and then maybe pull those muscles. They're very weak, and then obviously dislocate and relocate after all the hardware is put in place. And so that's very weak. It used to be when I started, when they had the old hardware for the hip replacements and stuff, once you had the hip replacement, that was it. You had to have those restrictions the rest of your life. Now, that was back then when if you weren't at least 60 years old, you weren't getting a hip replacement, because hip replacements back then lasted for about 10 years. They didn't do very well. And they didn't want to do a revision to the hip if they didn't have to. It complicates things, and we'll talk about that in a few minutes. What the heck is a hip revision? Now just think of this. If you have hip pain and they need to do your hip replacement, you haven't been walking right for quite a while, which means that these muscles of your butt, of your hip, are weak in the first place. Then they go ahead and have to pull and stretch and cut some of the tissue to get to the bone to replace it, and it weakens them even more. So they're very weak, as well as they're going to be painful after having this kind of surgery. Now, the front approach, on the other hand, you really only have one restriction. Some doctors have another one where you can't swing your leg out to the side, or what we call abduction, for a little while. But the biggest one is that you can't bring your leg backwards. You can't kick your leg backwards, because that brings the head forwards as you kick your leg back. And since the tissue is very weak in the front, there's a possibility of dislocation early on. But there are no restrictions of crossing your leg or bending forwards or pulling your leg up or turning your leg in. And so you can do all the things like wipe your rear end, tie your shoe, put your sock on, put your pant leg on, all these things that we take for granted before you have a hip replacement, that they say, wait, now you're restricted. The anterior front approach is, I would say, should be the new gold standard. It just hasn't been done long enough. But I feel at some point the posterior lateral approach probably will fade away in the sunset as the newer surgeons come out of school and probably just do the front approach. You're still going to have some of the old doctors that's been doing it for probably 20 years or 30 years or so on, and that's all they've ever known. That's all they've ever done. They didn't want to learn the new approach for whatever reason, and they stuck to the good old try and true. And so you're going to see one of those doctors. Be mindful that there is another approach, a front approach, and you're probably, if I had to have a hip replacement, I'd be doing the front approach. I would not do a back posterior or posterior lateral approach. It's absurd to do that with those types of restrictions. It's just the recovery's longer, because it's all those butt muscles that do all the big work, all right, and all the huge restrictions with them. So I implore you, if you ever have to have one, or family has to have one, you find a surgeon that actually does the front approach. Now, let's just say that for some reason it broke or fragmented. They might, for some reason, might not be able to come to the front approach. They might have to do a back approach, maybe because you've done something to the front of the hip, or any of the muscles or vessels or anything around the front of the hip. You might have to have a back approach. But I think that there's going to be rare in probably 10 or 15 years. You probably won't see them anymore. As well as robotics is coming online with knees and hip replacements and stuff like that. And so the robotics is going to be doing a lot of this. So if you thought something was minimally invasive before, it's going to be ridiculously minimally invasive. A lot less cutting. When they do cut, it'll be laser precise. And so your issue with infection or bleeding or something like that from the injury, from the surgery, is going to be a lot less. So the outcomes are going to be a lot better. Yeah, I had when I did home care, I had one gentleman where he had a hip replacement and he was chronically dislocating. I mean, I went to go do his evaluation like 4 or 5 times and reevaluation because, he literally would stand up and the darn thing would dislocate. And so what the surgeon actually did is he put a pin literally right where this elastic piece is that this goes into the socket and put, where'd my other guy go? And put basically a slot in the socket, and so that the pin could hold in, and that was it. And that's where he pivoted from, and so he wouldn't dislocate. But I remember talking to the surgeon, and the surgeon said, "Yeah, I mean, this is the only thing we could do, but it's going to wear a heck of a lot faster because it's not articulating around the entire or moving around the entire surface of the ball and socket. It's really only moving from from one angle, so it's going to wear awful in that spot." That's the best they could do, and don't know whatever happened. I stopped doing home care because I got burned out because I'm not an introvert. I can't sit in a car by myself all day and sit on a laptop all day. Obviously, it's just not me, and so I had to get out of that. That just wasn't for me. But yeah, I've seen that once where the guy was constantly dislocating, and they had to do that. I got 7 in the house. Hopefully I got a bunch of 7 and 8 or more thumbs up or thumbs down. Anybody have any more questions about this so far? Yeah, Medic Bunny, that's basically what they said. They, it was what they call a cost-benefit ratio. The benefit was is you're going to stop dislocating and be functional. The cost was if he doesn't, who knows what was going to happen? Break something else, break the hardware so that they couldn't do the hip replacement, and so. Well, Emilio's home right now. Well, Nicole, everybody's home right now for the most part, unless you're a necessity in the world, or I should say, in what was I going to think in the modern day world? I mean, I had to work today. I work in the healthcare field, obviously. All right, so if you guys don't have any questions, we're going to talk about revisions. Now, I don't see revisions, nothing like I used to. Probably 10 or 12 years ago now, I used to see a lot of revisions. And I think that's because they are moving from the old style hardware to the new style hardware. I think that's probably the big reason why I saw a lot of revisions of knees as well as hip replacements. But the trouble with those, one is if there's any history of osteopenia, which is osteoporosis, excuse me. Osteopenia is pre-osteoporosis, or osteoporosis, which basically means the bone density is less. And what the heck does that really mean? That means if you think of the bone as Swiss cheese, the worse or the less density you have, the more holes and the more porous your bone is, which means that it's very weak and can break. So Miss Trucker, Brown Eye Trucker, that's a heck of a name. I can't get over that. So she's asking, what is the pain called that shoots through the top of your thigh bone that meets the pelvis? Hope I described it correctly. That's fine. Don't worry about, this is Average Joe, PT. We don't have to worry about that terminology all the time. All right? So if you're wondering about, I'm gonna tease you. If you're worried about the ilium and where it's referring pain down the L2 dermatome pattern, or in this case, the hip bone to the thigh bone, right? Because that's really all it is. That pain could be a lot of different things. If we're just looking at it as an orthopedic problem and it's not coming from something else like a hernia, there's 100, I'm not a medical doctor. I'm sure there's 100 different things that I'm not even thinking of that it could be. But from a physical therapy standpoint, if it's a mechanical pain, which means is we can make the symptoms better, we can make the symptoms worse, then we can actually treat it. And so if that's the case, you could have your pain from the psoas muscle in the front here, where I talked about one of my live streams, snapping hip syndrome. All right, it could be coming from that. You could be having some referral pain from that SI joint that I talked about last live stream. It could be coming from your lumbar spine, all right, the facet joint. It could be coming from the nerve is irritated off the side, referring pain down into the hip. It could be coming from the hip itself in the groin area. So there's a lot of different things. A lot of times, since you're a trucker, I know you do a lot of prolonged sitting. So my first thought is it probably is coming from the lower spine that's referring pain into the thigh or groin area. So I would have you, Miss Trucker, look at my back video that talks about just generalized lying on your stomach or doing the towel roll down at the tailbone so you don't sit like a letter C, which I talk about and very adamant all the time with some of my chronic back patients, that they don't sit like a letter C and cause a lot of pain at either the joint along the side, what we call the facet joint, or the muscles that are over elongated for a long period of time. And so you can look at some of that. That's probably going to help you the most, because it probably is my first gut without doing any, obviously not knowing your medical history, never meeting you or doing an evaluation. My first thought when I know someone that sits prolonged for long periods of time that's having pain in the thigh or the groin area, it's probably coming from your lumbar spine, but you would have to rule that out. And there's a lot of things that I call it the runny nose syndrome. A lot of things cause a runny nose. A lot of things can cause pain in your thigh. I want to say he has cancer because he got sick on Friday on the weekend and all of a sudden he had headaches and fever, so went to the clinic in Manitoba. They won't help him and try different. Oh, you're welcome, Brown Eye Trucker, but that's what I would do. I look at my playlist. Probably the disc one would be decent, or just postural sitting. I think I have one that talks about muscles that are over elongated, like the three main muscles, I think was one of my videos. They usually cause a bunch of pain. There's a wonderful lady, I'm not sure I think she passed away, Shirley Sarman. She was a guru in muscle length tension issues. Some muscles that are over elongated, some muscles that are shortened. And so we talk about the different muscle groups and we look at them as what might be causing the mechanical issue, whether it's weak glutes, tight hamstrings, weak abdominals, tight hip flex. These muscles in the front can all cause stress to the back. That's one philosophy. Another philosophy of physical therapy is Robin McKenzie. He passed away too. He was a big guy in disc issues and joint problems and trying to make sure that your spine is symmetrical, that you have equal motion flexing forwards as you do extending backwards. You need to have equal motion in both directions, and most people that have back issues are probably more flexed and have no extension. So that's one kind of approach. So there's a couple of different philosophies. There's functional movement screen, or FMS. I don't know a lot about that. I know a friend that took a course. This was probably 6 or 7 years ago. He's a physical therapist, really nice guy up north in Pennsylvania, New York State area. And, there's a whole gamut philosophy of their approach, but some of their underlying concepts are based off of Shirley Sarman and kinesiology and the mechanics of how the spine and arthrokinematics of how the spine actually moves. So, if you're having hip pain and you're younger, you definitely want to make sure, and it's not trauma, you definitely want to make sure that you go and see someone. So your primary care doctor, they're going to refer you probably to a physical therapist. It should be what they do. Now, unless they see something god awful on an x-ray or something like that, they might send you to an orthopedic doctor or a doctor of osteopath, a DO. They're both medical doctors, just a DO specializes specifically, boy, that's tough, in the actual joint. They're kind of like a medical doctor with physical therapy and chiropractic techniques all rolled into one. So it's a specialty like orthopedics would be, or a neurologist or a neurosurgeon or anything else. But if you see a physical therapist and you're younger and you have hip problems, we're going to have to rule out the spine first, the SI joint, listen to the person really well, and then try and figure out where the pain's coming from. Some people, if it's younger, it might be a labral tear in the hip. And I talked about that. That was one of my really good videos that I did probably 3 months ago now. I think I got close to 900 or 1,000 views just off of the content, because apparently a lot of people have hip and snapping hip problems that they had questions about. And so it did, for me, as being a no YouTuber, I call myself the microscopic YouTuber. Actually got some decent views on that. And so possibly that labrum, you have one in your shoulder, but you also have it in the hip. And that's kind of the rim around, and that kind of deepens the socket more, and so it allows a little more flexibility in the hip, not as much as it does in the shoulder, obviously, but you have to have some stability more in the hip, obviously, because you got more weight. You got your entire upper body going through those hips, and so they got to be a lot more stable. You have to have more stability than mobility in your hips than you do in your shoulders. That just kind of like makes total sense. Otherwise, you probably would have. It would be interesting how that would work out. Honestly, I'm not going to no doctor's office right now unless it's an emergency. And that's 100% correct. That's right, Ms. Trucker. You shouldn't. And all the doctors of all specialties say exactly that. Obviously, you still want to listen to the CDC and the World Health Organization. But I implore you to only listen to physicians on YouTube when it comes to this virus, as well as any other virus. There's a cool guy out there. If you want to look at my Facebook page, and if you want to look at that, I had a share link of a doctor. I think he's a surgeon. I don't know what kind of surgeon he is, but he went over the specifics of COVID-19, what actually happens to the lungs. You know, that people, when they are dying, they're dying of pneumonia or sepsis. It was a really good eye-opening experience. I loved him because he was like me. He was down to earth, talked to you straight up, straight from the hip. You know, he's not one of these flighty, over the head, snotty doctors. It was really nice. Really cool guy. And so I'd have you shout out if you wanted to learn a little bit more, you know, get it from the horse's mouth. I think it's like a 6 or 7 minute video. And it's got like 7 million views already, so you might have already seen it. So yeah, I wouldn't go either. So yeah, I would try a couple of my videos and see how you do. My gut is you probably will notice a difference. And usually the inflammatory process, which is what's probably causing a lot of your symptoms, usually calms down in probably 7 to 10 days. I usually tell people 5 days to a week. So you should notice a difference. As well as ice, don't heat it. Ice, ice, ice. You're getting referred symptoms from into your hip if it's coming from there, from the back. And you want to ice the back as much as you possibly can, 15, 20 minutes, you know, 4 or 5 times a day to really try and get that inflammation and pain referral symptoms to calm down. Don't heat it up. Heating just speeds up the process. So I got Medic Bunny. She's got a question. I'm going down the list here. Of course, poor Nicole's talking about some family member that passed away, and my condolences come out to you and your family. Yeah, cancer is awful. A lot of my family members died of cancer, and if I had to go, I hope I don't go like that, because usually a lot of times you suffer. But anyways, Medic Bunny says, I have pain in the posterior, oh, she said posterior part. Oh, that's fancy. Posterior part of my hip, almost in the outside of the buttocks, and my hip pops. When it pops, it feels better for a while. Yes, so you're having instability within the joint space, which builds up pressure. Okay, that pressure, you can have it in any joint, whether your knuckles or your toes or your elbows or shoulders or whatever. You have gas bubbles within the synovial fluid. Cavitation takes place. All right, you get a popping sensation and the pressure is released. So you're having some sort of overstressing that joint and causing the joint to build up pressure. So you're going to have to figure out why you're having a lot of popping. The posterior part of the leg, it can be a couple things, or posterior part of the hip, excuse me. It can come from piriformis syndrome. You might want to look into my piriformis one to see if it's coming from there. You could be having some sort of glute medius weakness, which is the main muscle on the side that brings your leg out and keeps your hips level when you stand and when you walk, so your hip doesn't drop. That muscle is very important and gets injured when you have a hip replacement, or gets traumatized, I should say. You could be having some pain referred into that backside coming from the SI joint or the facet joint. It might not actually be the hip itself. Oh, my Facebook name is probably just Joseph Kenny. Kenny. I never really thought of it. Here, let me pull myself out for a second and see. I'm not on it a heck of a lot. Okay. They've changed Facebook again. Now you can buy stuff. It looks like almost like eBay or Craigslist. We must have just changed it, and I'm having a problem here. It's probably because I'm also using a lot of Wi-Fi, so unless they've just changed it. But anyways, yeah, it's Joseph Kenny, as well as I have my Instagram account that I try to get on at least once a week. Okay, Nicole, you don't have to tell us your Facebook page. That's fine. Oh, I have. Oh, wow. Okay. You got to be good because my mom is now watching. So everybody be nice. My mother is now watching. Apparently they got her hooked up. She's not actually in the actual chat. So maybe if I ever get over there, now that they have us hunkered down here, I can't see my family at Easter time, and so maybe sometime this summer I can get her hooked up a little bit better. Or my nephew could actually help and get her so she can actually get into the chat. That's right, I'm calling you out, my nephew. So it would be very nice if you could get your grandmother on YouTube. All right, enough of the shout outs. All right, back to the story here. I got 8 in the house. 8 in the house right now. Beautiful to see. Beautiful to see. All right, and so let's go ahead and talk a little bit more about the hip. So we talked about ways of reasons why you might get a hip replacement. We talked about the two types of real hip replacements, and we also talked a little bit about where hip replacements are going in probably the next 10 years. They're going more, hips and knees, I should say, replacements. They're going more towards robotics, and so you're going to see recovery time probably even faster. The reality is insurance companies don't want to pay for a hospital stay, and so if they can do, I know this sounds crazy, but if they can do same day surgery, which means you go in for the surgery and you go home the same day, that's what these insurance companies and where the medical field as a whole is probably going to be in 10 or 15 years, definitely within my career, willing and that whole bit. And so I do see in the next 10, 15 years that this will be what we call an ambulatory surgery. One day you go in and you come out and you come home the same day. And so as things get more perfected, as the hardware for replacements actually get even better, the material and how it's made, and as well as the surgical procedures become more precise, less traumatizing to the body, you're going to see people do much better with less complications, because the less trauma you can put on the body, the faster it recovers, so you don't have to worry about things like blood clots and atrial fibrillation and 100 other things. Somebody who has a stroke or some sort of anoxic event that happens after being under for surgery. So you're going to see things change. Oh, Brown Eye Trucker says hi, Mom and nephew. Nice. My mother would probably say the same thing. Though I do have both my mom and my dad's personalities depending on the situation. I definitely see a little both of them in me. And so anything that I do wrong or say wrong, I blame completely on both my parents. And that's called passing the buck. And likely so, anything that happens positively, which there's a lot, and they know, and you see me, how my channel is actually quality and content is actually improving. I'm a hard worker. There ain't nothing that's going to substitute for hard work and consistency. That goes for everyone. Okay, so enough of that talk. Now, let's go ahead and talk about what the heck. Now, I did start to talk about, before I got sidetracked, revisions, before I answered some of these questions on the chat. And so what I was saying is 15 years ago, I saw a lot more revisions because the material of the knee and the hip replacements that were done weren't as good as they were before. And so they didn't last as long. So they had to do revisions on these people because the hardware broke down, and they do an x-ray and they start to see where the hardware was what they call it was failing. In reality, it was wearing out and making the joint unstable, so they had to do something. So when they do a hip replacement, they literally, you could find the surgery online. I tried to tell people don't watch it because it usually will scare you half to death, and it will just make you, if you have anxiety, which most of us do at some level, it will take that to the next level, and you should not do that to yourself. But so what they do is they just go in. I talked about if they do the back approach, the posterior or back lateral approach, they have to go in and go through that muscle tissue. They have to cut through the ligament. It's called the wide ligament, or the Bigelow ligament, it was called. And that's a really 3 ligaments that wraps around the neck of your actual femur, and it's cross-layered. And so that cross-layered is really what makes this a very strong ball and socket and can take a lot of trauma. They have to cut through that, pull it apart to get the head out. Hate to tell you, they have to cut that head and neck off, and they put a new neck on the end of the shaft of your thigh, or what we say your femur. They put a new socket inside here, a surface of it. They put you back together. They sew it on up, dissolvable stitches, and they go ahead and sew out all the way out, and they're done with the surgery. Sounds pretty simple, huh? Make it real simple, but trust me, it's not simple. You have to be a surgeon. 14 years, or give or take. You're basically in your late 20s or early 30s when you get out, because in reality, there's no Doogie Howser MDs out there, if you all know what I'm talking about. And a newer surgeon that's doing these newer techniques like the front approach that's been going on, it's not new, but it's the newer one. All right, they're going to be probably in their early to mid 30s. And so that's that approach, what they have to do. The same thing whether they do the front approach, they have to bring your leg out, abduct it, dislocate. This machine literally is going to distract or dislocate the ball from the socket. They have to cut from the front here, cut the head off, replace it, and put it in, literally let go, and it just kind of like a rubber band pulls it back in place. And so you get a lot less trauma, and you're not affecting the back muscles of the hip at all that allow you to stand and sit. And like I said early on in this live stream, you don't have the same restrictions. You have a lot less restrictions, and you can go about your daily life not worrying about dislocating every second of the day. Now, one reminder is the restrictions nowadays are for a non-complicated run-of-the-mill hip replacement. They run basically about 2 or 3 months. After 2 or 3 months, they go ahead and discontinue those particular protocols, and you can go ahead and go around your merry way, because your reality of dislocating is probably almost zero. So, long ago with the old hardware, you had to keep those protocols your entire life, those restrictions, all right, when in reality you're probably towards the end of your life anyways when they would do the hip replacement in the first place. So it wasn't a real issue. But now that they're doing them in your 40s, you might live 60 or 70 years. So who knows what's going to happen, because it's only been, like I said, the last 5 or 6 years that I can see that they're starting to do these hip replacements on younger people. And I don't know, when these people get into their 60s or 70s, 20 or 30 years from now, how that hardware will be. There's no research to say that it's going to be all right, because it hasn't come about yet. This is new stuff. The hardware looks like it will last that long. Hard to tell. And so you might start to see a whole new case of people getting a lot of revisions, because when they were in their 40s, by the time they were in their 60s or 70s, the hardware started to fail again. They just beat on it too much. And so the next generation of physical therapists, or towards the tail end of my career, we might start seeing another revamping of revisions again of the hip and knee, if we haven't thought of any other new technology like stem cell research, or who knows what else might happen in 30 years. We're lucky if we can project 10 years of where the medical field will be, let alone 30 years. All right, Medic Bunny, thanks for coming by and staying. Don't forget Saturday's show and Sunday's live. All right, so if you guys have any questions so far, if not, we're going to go ahead and we're going to talk about some exercises or some issues that you might have, or what your expectations should be after surgery, and what I see with people with their expectations. And this is kind of human nature kind of thing that happens, and we're going to relate it to people who have a C-section or cesarean section after having a baby. And let's see if I can get this. It's kind of, this thing is still new, and it fights with me a little bit here, so just bear with me for a second. Boy, this thing is, there we go. It's designed to come off, but it don't like to come off too easy. There we go. So when we talk about cesarean section, everybody, they've been going on for years and years and years. You could have a complication, but they're not too bad. But the reality is, it's surgery, and anything and everything can go wrong during surgery, whether it's something that's done every day or not. And that goes for the same with hip replacements. You go in, hopefully everything is fine. You've had all your lab work done. Excuse me, I ate too fast before coming on the live stream. And, you could get a blood clot. They do injections to mitigate that. We do have these pumps, which are called thrombo guards, that go onto the calves, which hopefully will keep the blood flow pumping and not coagulate or sit in an area and cause a blood clot. But, after surgery, expectations are that day or by the latest the next morning, you're getting up with physical therapy. And the reason why is because of that specific thing is to mitigate and reduce the risk of blood clots. That's the first thing. Or any signs of digestive issues or bowel problems or breathing problems. The last thing you want to do after having surgery and being put under and coming out of it is laying flat for long periods of time. That's just disaster written all over it. When I first started in physical therapy with hip replacements, they would keep people in bed much longer. They try to get them up the next day, but if they didn't get up, they're like, we'll try the next day. We've had enough research and seen enough problems that go on with patients that we need to get you up immediately as possible that day. And family still, we see, I don't see as much because I don't do inpatient as much anymore. That's not really where my love is. My love is mainly outpatient. But, when I do have to cover and do inpatient, and they're always like, well, they just came out of surgery. You're going to get them up already? Yes, we have to get them up. And so I love how people who have absolutely no medical knowledge at all think all of a sudden they have medical knowledge. That goes with the COVID-19 problem too. And so I hopefully be able to bestow some knowledge that you guys will at least take heart and see the reasons why we in the medical field do what we do. And you guys should just sit back and relax and enjoy the show. But that's one of the main reasons why we want to get you up that day. As well as all of the other systems of the body can also have complications. Because let's say, we're putting you on medication. We've given you morphine. They might have given you who knows what else. They might have given you the magic Michael milk or something else that the anesthesiologist gives you. And it's going to slow your digestive system down. It's going to slow your breathing down. And so we want to make sure that we get you up and get that crap out of you as much as possible. Sweat it out, poop it out, pee it out. IV bags to get the fluid going through you to get that stuff up because it slows everything down, your respirations, your digestive system. And we don't want to do that. That's not a healthy thing to do for a human body, whether it's an aging, 60 or 70-year-old that's getting a surgery or hip replacement, or whether it's a 40-year-old or 40-some-year-old getting a hip replacement or a knee replacement. You want to make sure that you get that stuff out of them as soon as possible. So that's another reason why they get you up quick. Any other questions so far before I keep kind of spewing some more of my knowledge? I ran out of chocolate milk. I'm very sad. Yes, it's lactose-free chocolate milk by the way. Poor Nicole's moving and she's having all kinds of disarray at her house. Yes, anytime you move, whether it's a smooth move or a not so smooth move, moving I should say, anytime you disrupt your life like that, it's stressful, and I guess go with the flow, and it's always easier said than done, and all these other cliches and phrases that people say and been saying forever and probably will continue to say. So I hope the best for you when you move, and hopefully safe, And don't hurt yourself. Hey, if you do hurt your back or shoulder moving, you can come and see me and see some of my videos. You can look on my playlist. I haven't done any lifting technique one. I haven't really needed to because my channel is more of home treatments after you hurt yourself. I guess I'm being retroactive versus being proactive. Besides postural stuff, I talk about strengthening. I guess that's being proactive. Oh, I lost another person. I'm down to 4 in the house. You know, that's okay. I'm fighting with some people with their live streams tonight. Everybody's got live streams every night. Some people are trying to entice you by trying to give you money or some paraphernalia or something like that. I'm giving you knowledge. Something that probably cost me over $100,000 I'm giving you for free. I say that's a pretty good deal if you ask me. And if Scully was talking right now, he'd probably agree. So I'm going to put little baby here back together. So his hips kind of move, or her hips, I should say. I should be biased towards one gender. But I blame my generation for doing that. All right, and so, Brown Eyed still here, ever faithful Miss Trucker herself. So let's talk about some strengthening. So, when it comes to the hip replacement, the main complication that I see a lot is this hip flexor muscle in the front called the iliopsoas. That's your main muscle that lets your leg come up and down like this or make you bend forwards when your legs and hips are fixed to a surface. Like me, I'm sitting. And so that muscle is easily to get inflamed. Like I've showed you in the past, it runs down the spine from the lumbar spine part of it. You have the iliacus, and this is the psoas, and the iliacus is in the inside. Those two muscles come together, okay, and they make one tendon that comes underneath your hip and comes across the front, and so that you can allow it to bring your hip up that way. And so when you have a trauma, a lot of people start to do this, or if you're really restricted because you had the back approach done and you can't cross your legs, or if you're in a lot of pain, what happens is this muscle here gets inflamed, and that's kind of a secondary problem. So I always tell my, what do you want to call them, clients or patients, that you want to ice this area in the front as well as icing the surgical site on the back side. So those people tend to have that issue there too. Because also these muscles are so weak that the muscles in front are trying to compensate for so much weakness that they're having on the back side, from either weakness before surgery or because of the trauma of surgery. They're also weak after, almost like a double whammy to these muscle groups, these hip abductor muscles or hip extensor muscles, a combination of both of those on the back side. Both of those can give you some issues. And so that's the first main complication you can have. Most people, they will have to lie flat on their back. Some doctors were really crazy with the wedge, the foam wedge, which goes in between your crotch or your groin, which keeps your legs apart so you can't cross your leg over and dislocate when you have the backside approach. When you have this front anterior approach, you don't have to worry about any of the stuff that I've just talked about for the last minute and a half. Now you can understand why, if you're going to have a hip replacement, you want a doctor that's going to do it from the front, because you ain't got to worry about all this other restrictions, these nonsense. I'm just shocked that people, I guess it's just a lack of knowledge. If they come to my channel, they'd have more knowledge, and to subscribe, hit the bell, they would realize, and probably have a lot less suffering. But to each their own. Anyways, and so, a lot of times they want to roll over and they can't because they have that side approach because they're afraid crossing their leg over. That would be a big no-no. Really, the only issue is, like I say, when you have the front approach, is you're lying on your back, you don't want your leg to drop off. And a lot of the restrictions for the front approach are much shorter too. They end up being like 4 to 6 weeks. Their approach for the front, the restrictions are less which like I said, the only restriction you have is falling backwards for the front approach. And the length of time that you have this restriction is less too. So I always say, I'm probably beating a dead horse right now. I implore you to go ahead, and if you have to have something like that done, go to the front. Oh, I got Nicole saying, I want to say that my ribs hurt, and I want to say I'm going to start my cycle soon though. And I'm going to watch the Vampire Diaries on Netflix. Okay. You go ahead and do that, Nicole. There's all kinds of, like, there was a whole phase of vampire, I watched them all as much as anybody else. I was a big fan of Sam and Dean Winchester, if you know that TV show. I think this is their last season. They've been doing it since they were practically teenagers, it seems. They made a lot of money off of that show. Good for them. All right. Anyways, to get me off track a little bit, the strengthening part you want to start to do when you can tolerate it. First thing you want to do is get your range of motion back within the protocol. So if it's a back approach, you want to work on bringing your knee up. I usually have people with their legs over a ball so that their legs can rock, and a lot of the weight is off of the hip, so they can rock and bring that knee to 90 degrees and no more than 90 degrees, so basically here. Okay, you wouldn't want to come any farther than that because obviously you might cause a dislocation of the hip if we're talking about the back approach. The next one you want to do is the clamshell, which I've shown in other videos, but in this case you're going to be lying on your back doing that, where your knees are bent up and you're just opening and closing your knees. All these exercises I'm talking about are targeting the hip muscles on the back because that's what got traumatized, and we want to try and get them to recover as fast as we can so we don't cause any issues down the road, like not being able to walk correctly because the muscles are weak. Forget the pain's all gone, it's all healed up. You don't want to be 3 months down the road and you have so much hip weakness, and they think it's because of the trauma from the surgical site, which could be some of it, but it's because we didn't target those muscles soon enough. So those are some different exercises. Another one would be lying on your stomach when you can. Now this would be for the back approach. The front approach, you wouldn't be able to lie on your stomach and lift your hip up until at least 6 to 8 weeks, depending on when the doctor would allow that to discontinue. But that's one approach that you can do for the back that you can't do for the front. So there is a few things that you can't do with the anterior approach, but overall, functionally, there's a lot less restrictions with the anterior front approach than there ever was in the back. I mean, after 2 or 3 months, yeah, the protocol is done. You're no harm, no foul. All the restrictions are usually lifted, and you can go ahead and go about your business. But that initial recovery is usually a lot better with the front approach. Okay. But I have pads and I take meds. Your stream is messing up, not the right meds. And now I can see you. Ha ha ha, Nicole. I really hope. It's definitely not my end. I'm looking at the camera, and the camera actually has 2 parenthesis lights that light up when it's on. Now I don't think I'm lagging a little bit. I can see the stream on my phone, so I'm not lagging at all. Though there is a delay, and I think it's because I amped up the actual frames per second, the quality of the picture, as well as the sound. So it might be a lot coming from because I'm asking my internet and my computer and my camera to go to basically maximum output for quality. I got 5 in the house. I had as many as 8. When I did the live stream on Sunday, I think I had as many as 10 or 11. That's the most I had so far. And I think that probably will be the case for a while, just because I think there's more people that do lives on Wednesdays. I probably need to get myself in some other different YouTube live streams and stuff like that. And so maybe, I can go ahead and get some other people from different genres to come over, and if they would like to come and see my content, and maybe we'll get some more people on Wednesdays. or maybe people just don't like to learn and want to learn something to hopefully help themselves or help their family members. I mean, that's always the case. There's a lot of content creators, and all they want to do is try and get more subscribers any way possible, even if it's people that won't watch their stuff, just to have the number, which in that case is kind of silly. You make your money off of commercials or ad revenue, people buying your merchandise, and so if people are just subscribing to your channel and they're not watching your content, they're definitely not gonna watch your video for the ads, and they're definitely not gonna buy any merchandise. So you're probably wasting your time. Though it's a free country, or for the most part, depending on where you're at in the world. Oh man, I got Oshi Slice, Oshai Slice is in the house, or was in the house just a few seconds ago, 5 minutes ago. Oh my Lord. I guess it's a first for everything. Hopefully I can bestow some knowledge onto them. Of course, they can call me anytime they like, because they have the in. Okay, so anyways, so we talked about everything that's really about the hip when it comes to hip, the replacement. There's the whole robotics part that's coming into new fashion now. There's not a lot of surgeons that do that. It's a new, probably, obviously they're going to have to go to some courses and learn how to use the darn thing, or get some reps that actually have the robot or the robotics, whether it's the Da Vinci or the Leonardo or whatever else they want to call the robot, that they can learn how to program it. And that's definitely what you'll see down the road. If you have a surgeon that does that, that would be even a better approach. Anterior approach, or the minimally invasive robotic surgery would be the person that you want to go see. I mean, I guess you could go to old try and true old doctor that does the posterior lateral approach that's done it a million times. I guess you could do that, but you know, that's hopefully going to be a type of surgery that is faded out, or at least not only done in certain circumstances down the road. That's sweet of you to say that, brown-eyed trucker. That is so. I hope that's true. You know, I started out with one subscriber, and it was a co-worker. I won't throw their name out because I don't want to embarrass them or anything like that. But yeah, or maybe it might have been my wife or my kids. I don't know. Anyways, it was a family member or a very nice co-worker. They were the first ones to subscribe. Which is kind of the norm usually, which is also kind of weird because they see you in a different light. They don't see the presentation. They have the memory of what their perception of you is, and so it's kind of interesting when they see a different perspective of you. Anyways, that's probably more of a philosophical debate than anything else. But yes, and I think that goes for all of us, Brown Eye. It really is making your content better each time, trying new things at least a few times to see if you can push your content that much better, and maybe make sure that you always look at your analytics to see if that type of shift in your programming actually is beneficial for you and you're not taking a downturn, as well as consistency. These people that are doing well on this platform, whether it's this or TikTok or anything else, unless you have a beautiful body and pretty face and you're basically just dancing around naked like some of those people are.
Sorry, I couldn't hear what you said.
Oh boy, I got my Siri talking to me. How about I just take her off because I'm moving my hands around too much, and Big Brother is interrupting my my YouTube channel. Anyways, it's all about consistency. That's what I was trying to get to, beating around the bush a little bit. So stay the course, stay true. Tell your subscribers or your content whatever's that this is when you're gonna do it. This is how you're gonna do it every single time, and hopefully over time you just kind of punch that wall, and you punch that wall a million times. Hopefully sooner or later you can kick through it. All right, enough about that mantra. And so we talked about the reasons why you might have to have a hip replacement. We talked about the two kinds of hip replacements. We talked about some of the major restrictions post surgery. We talked about why you want to get someone up as early as possible after surgery. We talked about really there's only a day or so that they actually want you in the hospital. All right, because obviously people come to the hospital, they go there because they're sick. So we don't want the healthy ones that are there for elective surgery to catch something while they're there. And so we want to get them out as soon as possible. They always think we're kicking you out, but that's not the reality. The reality is we know the statistics of keeping someone that's fairly healthy in the hospital, and the true reality that the longer they're there, the higher likelihood of them catching a bug or virus or bacteria. And next thing you know, they have another problem on top of having their surgery. So that's another huge problem, and why we want to get people out sooner the better. The other reality is it's about 3 days. And what does that mean, Joe, or average Joe? For every 1 day you're in the hospital, the recovery time is 3 days. And that's kind of across the board for everybody. And so if you're in the hospital 3 days, you can already expect, 3 times 3 is 9 the last time I knew my math. I didn't learn the new math. I learned the old math that sent stuff to moon, send stuff to Mars, and so on. So that math worked good for that apparently, but nowadays they have to have. Let me get off my podium. That drives me nuts, that new math. Anyways, and so it's 3 times 3 obviously is 9. So the longer you're in the hospital, the more complications you can have, as well as your recovery time becomes that much longer. So those are the reasons, or most of the reasons, why we want to get you out of the hospital as soon as humanly possible. That's safe for you, not because we want to get you out. Why everybody's so negative. Freaking negative Nellies drives me nuts. It's not because we're trying to kick you out. We're doing this for your own good. You just lack the knowledge. The technical term for lack of knowledge is ignorance. But ignorance has such a negative connotation to the word that people get offended by that. But that is the definition of ignorance. It's not a bad thing. Oh, I missed a few lines. People were talking here. Darn it. All right, so I saw Brown Eyed Trucker. Then she says, and my favorite sports is baseball. Well, that was Nicole. Honestly, I don't want to say I gave up, but I honestly do my video for the few people who are true to me, but I don't think I will make it as big as you or bigger. Okay, enough about that. Oh, I don't know about that. I think if you find your niche, what you really want to do, I mean, if I can't tell you what to do. Obviously, that's kind of silly. That's not nice. I see some of your stuff. I might put a few spins on it. Maybe I would show, driving in the truck. Maybe get a side companion. Maybe not a skull, but maybe think about what the heck was that with was the movie called Hanging Loose or something like that? My mom is probably yelling at me right now through the camera. It had that orangutan in it, and it had oh shoot, I'm thinking, it's I see his face, but yeah, it's just popping out of my head, and probably my sister-in-law is also screaming at me too about it. But anyways, if you have something else in your video, that would be cool. Maybe the orangutan. I think the movie was called Hang. It's an old movie by Clint Eastwood in his younger days. He's a truck driver, and he's got I think it was an orangutan that was with him. He did the whole right arm Clyde. I think that orangutan was called Clyde or something like that. That might be an idea. Aerial views, That might be something cool if you could do when you're out of the cab and you're seeing you're seeing the trucks move around. If you might want to get, if you're allowed to do an aerial view with one of those, just get a cheap old drone. Ain't gonna get nothing fancy. One of those drone things that fly around and bring it back. That might be something cool to cut in and cut out as B video and stuff like that. But those are some different things that I would probably. That's just me thinking out of the box for a second. You know, your content's good, but I would also add a few other little things that can really spice up your content. Just think out of the box a little bit. Try it a few times. If it don't work, you know, you can go from there. But just keep trugging along. Don't think that you can't get bigger. I'm not even small fry. I'm not even small fries, and so don't think of that. Just keep going forwards. It's very easy. Excuse me, I've done it myself a lot of times. Woe is me. This is a lot of work. I'm not getting anywhere. Yes, even the big creators all say that. Oh, you know, it's like you're going to get those hits where you might lose a bunch of people and then you get a bunch more. People start watching your stuff. Or you get a few people that watch it and then go away and then come back. You know, you just got to keep consistency. We'll get there. Just stick with me. You know, we're going to do just fine. Poor Nicole, she's thinking about her baseball. Yeah, it's going to be interesting what happens with any sports. You know, everything's been canceled, the NBA, everything. So who knows if anything will come back midsummer or you know, they might do, you know, half a year basketball, or I'm hoping they might do something like that. That would be kind of cool versus just canceling the whole season. Maybe they might, you know, we'll find out. We'll know by the end of this month statistically how everything's going at the end of April. Right around my birthday. Yay. All right. And so we talked about all that stuff, and we also talked about some strengthening. When it comes to having a hip replacement, you never really want to worry about stretching so much. There might be down the road, I'm talking like 2 or 3 months down the road, if you're having some weird referred pain, maybe from your iliotibial band, which is tendon and tissue along the side, because maybe we're walking incorrectly or something along those lines, you might have to do some stretching. But remember, to do a hip replacement, you have to stretch and dislocate everything. And so stretching really isn't a component of physical therapy early on. The component hospital is what I already told you, the hospital component of physical therapy to get you home. Outpatient wise is to regain the motion back within the restriction of the physician, get you walking without your equipment, get you standing and sitting and standing and walking properly with the least amount of equipment. Maybe start you with a rolling walker down to maybe a quad cane, which is a cane that has 4 prongs on the end of it, to a single point cane, and then hopefully wean you off of that. Essentially getting you back to where you were prior to the surgery. That prior level of function is where we want to get you to. You know, doing stairs, maybe working on balance and stuff like that if you're having some sort of balance deficit, and then trying to resolve the rest of your soft tissue pain. That's really what outpatient physical therapy is about. I think I still got 5 in the house. This stream was all right. I thought for sure I'd have a little bit more people in it. I think I'm fighting with a lot of live streamers. But a lot of those live streamers are probably gone by now. So, not too sure about that. But this was a good lesson on all the type of issues, types of surgeries for the hip. Do you guys have any questions at all in regards to the hip at this point? Or the hip surgery itself? Wow, there is a long delay on this. I mean, I got like maybe a minute, solid minute delay on this. Well, thank you, Brown Eye. I appreciate it. It seemed like there was there's a lot of lag. So do you guys have any more questions? If you don't, I think we're going to call this a solid live when it comes to hip replacements. If you guys have any questions at all, you can go ahead and leave a comment down below, and I will go ahead and answer it when I possibly can. If there's anybody in here that was new that I didn't see or I didn't name, I apologize, but I will look after the stream and subscribe and watch some of your content and leave a nice comment. Yeah, that's where I'm stuck at. Is the actual picture is great, but the lag is something fierce because I'm really running it as the highest 1080p that I can. And probably if I ran it at 720p, it probably would be just fine. I'd be able to run it almost maybe a 3-second delay or something like that. So I might reduce the quality next time just so that the stream is a little bit faster. All right, folks, we're going to go ahead and call it a night. And like I always say with good old Scully here, we want you to look up and keep smiling. All right, see you next time, folks.